Nuestra Gente is offering Lupus Program to all residents in Lucas County. Our mission is to inform and educate our community about lupus.
I was diagnosed with lupus when I was 19 years old. I was 5 months pregnant with my first child, my son. I first found out I had lupus by the discoid rash that was forming on my face. The rheumatologist did a number of studies on me and was then informed that I had lupus, systematic lupus. I had a pretty normal pregnancy. After my son was born, I did have some complications. I had a pneumonia and ended up in the hospital for 3 months. One of those months I ended up having to go into rehabilitation and learn how to walk all over again and use my arms and move all over again. So that was pretty difficult. That was one of the most difficult times in my life. Fast forward to 2000, I found out that I had some really bad pains in my ankle and some pains in my hip, and it was due to the steroids that I had taken previously. The bone was dying because of the steroids that I had taken. So I had to have a hip replacement surgery, and this was all caused by the lupus treatments. I had to go through some surgery. I still haven't replaced anything in my ankle, but I will soon have to do that, and I will have to replace the other hip. I do also have Raynaud's syndrome. I've gone through losing hair and the rashes. I've pretty much gone through everything. So I have 2 children and had no complications with the pregnancy. There's been a lot of ups and downs. It's taken away time away from my family and friends because I can't go out with them, enjoy time outside with them, or even indoors with them doing things because I'd rather sleep. And a lot of people don't understand that. It's hard to understand when you look healthy, but you don't feel good inside. And along with lupus comes depression. And the depression comes because you're not yourself anymore. You're not that active, vibrant person that you used to be, and you realize that. I wonder what the future even brings. How much harder or how much more difficult is it going to be in 5 more years?
My disease affects me seasonally, only in the wintertime or the colder months. Whereas you may get frostbite being outside below temperatures that are 32 degrees, I may lose a toe or a finger because my blood doesn't circulate correctly. So I may end up losing a toe or a finger if I'm outside for long periods of time below temperatures of 32 degrees or below, or freezing.
I want to emphasize that early diagnosis is important because there's really now more effective treatment for lupus compared to 50 years ago. We ask our patients to get evaluation by their primary care doctor if they have symptoms like sun sensitivity, joint pain, coldness of the hands and feet upon exposure to cold temperature, chest pain, and often primary care doctors will run screening tests for lupus, and if these tests are positive, then the patient will be referred to the lupus specialist.
Please support lupus awareness.